Hello everyone, I'm Mike Jones and we're back here to continue with our Medical Exercise Training 101 ebook series. Now we're on tip number 31. Now, if you haven't, please go over to met101ebook.com and download your copy of the ebook. Just a little background on the book itself. We published this back in 2014. It is now 2024. And folks, I would probably say of the 101 tips, probably 100 of them still stand fast today just as they were written. We've only had one or two that we had any significant variations. And I think that's because we looked long term and had a long vision of medical exercise training and what it could do. Now, please understand, as a physical therapist, I never wanted to see medical exercise training take the place of the physical therapist, the occupational therapist, the chiropractor, the massage therapist, or the licensed medical provider, particularly in the rehab area. But with the changes in healthcare reimbursement, we needed to have someone that could provide safe and effective exercise, as well as being the eyes and ears of the medical community out there to identify individuals that needed to go back for further services or to make sure exercise wasn't done in an intense manner that would cause injuries. So I think we've done reasonably well with that. So please get a copy of our MET 101 ebook. We feel like it is a guideline for you to establish your practice, expand your practice, but also to provide professional services. So today we're going to talk about tip number 31. Now, if you don't mind, as always, I'm going to read the tip. And this one is a rather long tip. So we're going to read the tip. And then once I read the tip, we're going to talk a little bit about it or talk about it as we go along. So this will be tip number 31. Please, again, download your free copy. And if you would, indulge me as I go through this one. All righty. Where do I start building my MET practice or medical exercise training practice? Well, to start your practice, look at current clients and their success stories with you, of course. Now, I ask this question in all of our medical exercise specialist workshops. I ask the participants how many of them have worked with total hip replacements, arthritis, back injuries, back surgery, hypertension, diabetes, or any number of other conditions. I ask how many of them have successfully helped a medically based client improve their function, lose weight, increase their strength, range of motion, or endurance. In every workshop, probably 80% of the hands go up immediately. Everybody raises their hand. Then I ask the group if any have contacted the client's physician, physical therapist, or chiropractor. 90% of those hands go down immediately. You guys are doing the work, you're producing the outcomes, clients are getting better, but you don't follow through with the medical professional. So with that, why don't medical exercise professionals contact doctors, therapists, or chiropractor? If nothing else, it's just simply a professional courtesy. Folks, the doctor, the therapist, and the chiropractor may not be as well versed in exercise as you are. Okay? That's not a bad thing, because if they were, there would be no need for you, the medical exercise professional or the fitness trainer. So with that, your clients go back to their doctor, therapist, or chiropractor and talk about all the great stuff you're doing with them. They do. But you lost an opportunity for referrals because you didn't attempt to communicate with the client's physician or the physical therapist or the chiropractor. Folks, if Mrs. Reynolds is able to now go to church, whereas before she couldn't get out of the house, and she's able to go to church now, and she's able to walk from the parking lot into the church and sit in her pew and then leave, that's huge. She tells her doctor about that, or her therapist or her chiropractor, and she's talking about all the great things you're doing, but you lost a huge opportunity to communicate with that doctor, therapist, or chiropractor by just sending a professional courtesy in the form of a progress report. Let me continue. Start building your MET practice by looking at your current clients. I know you have new clients fill out demographic forms. You probably ask the client to note their physician. To build your practice, the first thing you're going to do is look at the current clients, note their physicians, and start sending introductory letters to those physicians. It's a simple one-page letter outlining the client's exercise program and goals is sufficient. With that, the letter basically says who you are, what you do, and you're working with their patient. Name the patient and list the goals for the exercise program. Also, thank them for any information they may provide with regard to precautions for the client. Now, please understand, law says, especially these HIPAA guidelines, they say you may need the client to sign a release of information form before you can communicate with that physician or therapist or chiropractor, and they can communicate back with you. Because remember, anything that's in that patient's chart in the doctor's office or the medical professional's office does not belong to the medical professional. They are custodians of that information for the patient themselves. So you may need to have the client sign a release of information form. They normally are good for a year, so every year, just have the client sign a new one. Next thing, send out introductory letters to 3 medical professionals in the community with whom you want to establish referral relationships. I recommend a physical therapy clinic, a chiropractic office, and a general practitioner to target. Notice the term target here. This is your medical target marketing list. Initially, focus your efforts on establishing relationships with these medical professionals. I know you want to try to talk to everybody, but you may have to make sure that you focus your efforts and produce a good outcome with regard to establishing a relationship by focusing on 3 to start with. Do not try the shotgun marketing method, This is when you send a letter to every medical professional in your community. Here's what might happen. If you send out a good letter and a brochure, you might get 10, 15 responses. But how many new MET clients can you take next week or next month before you're overloaded? Now, if you can't take 12 or 15 new clients, which may result from your great marketing efforts next week, then what you've done is you've actually generated business for all the other local health clubs and fitness studios and personal trainers in the community. Because I'll be honest with you, the doctors can't differentiate between you, the professional medical exercise professional, and just the guy or girl out there who's just looking to get some clients that have medical conditions. Let me continue. The doctor referred the client to you because you reached out to him or her. He or she thought MET was a good idea, and now they want to establish a referral relationship. They send the client to you, but you don't have room to schedule the client. So what does the physician do? He finds another fitness facility to accept the referral. You've bitten off more than you can chew with the shotgun method of marketing. You sent out a letter to everybody. It was a great letter. Some people responded. Now you're overwhelmed, especially if you're a solo practitioner. You've set up the other local health clubs and studios and personal trainers in your community to get referrals because you couldn't handle the demand you generated. Great idea, great marketing piece, but can you handle the influx of clients coming in? So let's start with 3 referral sources. The referral relationship rule is, if you are a solo practitioner as a medical exercise professional, start with 3 referral sources. One medical exercise professional can normally handle 3 referral sources. For each additional staff member you add into your facility or into your practice, develop a new referral source. Now, you're going to develop that referral source before you actually bring that individual on board. So as you're bringing them on board, you're finalizing the relationship. You've got everything going and you're starting to get referrals. With that, you don't want to establish referral relationships so fast that you can't nurture them and grow them. Folks, just because you send a letter doesn't mean that's it. They're going to send clients and that's it. This requires an ongoing relationship, and that relationship will morph or change as the doctor or his or her clients or the therapist or his or her clients have various needs. So with that, remember, communication is required between you and the medical professional when managing an MET client. If you have too many clients, you can't make the necessary phone calls or send the progress reports. You'll lose that referral source. Folks, I can't tell you how important it is to send progress reports and communicate. That is the one downfall I see across the board for medical exercise professionals. The tendency is to shy away from communicating with the physician or the therapist. I'm not really sure why we see that, but we've seen that over the last 30 years. This idea of sending progress reports, communication, will allow you to find other referral sources. But also, if you don't communicate, that doctor, therapist, or chiropractor will find another medical exercise professional to make it work. So the key thing here is communication. If you want to have the relationship, you must become, to some degree, part of that medical referral network. That means you have to step forward. You have to communicate verbally in a written format. And in that written format, it has to be professional and clear and concise. So please, if you would, please download yourself a copy of our MET 101 ebook. We talk about this as well as other tips in the manual. And I think these tips will be very helpful for you. And please tune in, bookmark this page so you can come back and get more tips. So all the best. Thank you for watching. Take care.